The Coma Research Center of the Fondazione Istituto Neurologico Carlo Vesta of Milan has long been involved in research on disorders of consciousness to better understand the mechanism underlying this condition and to ameliorate the diagnostic procedures. Indeed, correctly identifying the real level of consciousness of patients has important consequences for both caring and management reasons. However, this could be very difficult in all those situations where there is not the daily presence of clinicians, such as long-term and domestic settings. Since the Coma Research Center promoted a great amount of research of caregivers of patients with disorders of consciousness in the past 10 years, thus developing great experience with them, we thought that the time is come to formally involve also caregiver in the evaluation of the patient's level of responsiveness, as already suggested by the international guidelines on disorders of consciousness. For this reason, we recently started to develop an instrument, the Social and Family Evaluation Scale, that can be used by caregivers of patients to evaluate their level of responsiveness. The SAFE scale will be useful to monitor the patient's level of consciousness over time in all those situations lacking the presence of expert clinicians. Most importantly, involving caregivers in the assessment procedures can give rise to patients' better responsiveness. The involvement of patient caregivers in this process is most fundamental as they have a better knowledge of patient history and sometimes are the only ones spending most of their time with patients. Of course, there are several steps to follow yet. First of all, SAFE needs a validation process to date, and we are planning to translate it in multiple languages. Moreover, we hope it will be implemented in telemedicine for remote monitoring.